Have you ever thought about how something really tiny, almost invisible, like a skin mite, could actually tell a much, much bigger story?
It's fascinating, isn't it?
Yeah, not just about the animal itself, but maybe even about the health of, well, a whole ecosystem.
Absolutely.
Today, we're doing a deep dive into exactly that, Chorioptic mange. It's this skin condition caused by mites living right on the surface. We've been looking through a whole lot of research, trying to understand how these mites affect two really different groups.
Right, we're talking camelidae, so your llamas,
Mm-hmm.
alpacas,
Mm-hmm.
and then cervidae, which is, deer and their relatives.
And our mission today is to really unpack the causes, the etiology, as it's called, the clinical signs you could actually see, and how it's managed.
And we'll find some surprising differences, really, in how it shows up and what it actually means for each group.
It's about connecting these small details to, well, a bigger understanding, right? Host parasite stuff,
Yeah,
even environmental health.
exactly. It's all linked.
You've given us the sources, and we're here to pull out the key insights for you. Okay, let's unpack this.
Great. So let's start with the basics. Chorioptic mange, it's essentially a skin inflammation, dermatitis.
Okay.
And the main things you see are itching, intense itching, we call it pruritus, and crusting on the skin.
Then what's causing it?
The culprits are mites from the Chorioptes genus, mostly Chorioptes bovis. And the really crucial thing to remember is they're non-burrowing.
Non-burrowing, so they just live on top.
Exactly. Right on the skin surface. They feed on skin debris, secretions, that sort of thing.
Okay, so if they're on the surface, how do they spread from one animal to another? Is it just touching?
Mostly, yes. Direct contact is the main way.
Right.
But they can also spread indirectly. Think contaminated bedding or maybe grooming tools that are shared between animals.
Ah.
And interestingly, you tend to see more problems in colder, humid weather.
Why is that?
Well, the mites can actually survive for longer off the animal in those kinds of conditions.
Makes sense. And are some animals just more likely to get it than others? What are the risk factors?
Yeah, definitely. General things like overcrowding can play a role. Poor hygiene, obviously.
Mm-hmm.
And anything that weakens the immune system, immunosuppression, makes them more vulnerable.
So like other parasites then?
Pretty much. Young animals or animals that are already immune compromised for some other reason, they're usually more susceptible.
And what would you actually see if an animal has it? Like the general signs?
Well, initially it might be pretty mild, just some itching, maybe a bit of scaling on the skin.
Okay.
But if it gets worse, moderate to severe cases, you'll start to see the skin thicken up. There'll be crusting, definite hair loss in those areas.
Ouch.
And because it's so itchy, the animals often scratch or rub themselves raw. That's self-trauma.
Which leads to other problems.
Exactly. Can easily lead to secondary bacterial infections getting into that damaged skin.
Hmm.
And in really chronic, long-lasting cases, the skin can get super thick and leathery. That's called lichenification.
Lichenification.
Oh, and you also see something called hyperkeratosis, which is just an abnormal thickening of the very top layer of skin.
Wow. So if a vet suspects this, how do they confirm it? How's it diagnosed?
It usually starts with just looking at the animal, the clinical exam, searching for those typical lesions.
Right.
But the key step is taking superficial skin scrapings, just scraping the surface layers of the affected skin.
And then looking under a microscope.
Precisely. And because these mites live on the surface, they're actually relatively easy to find compared to, say, mites that burrow deep down.
That makes sense.
And another thing that helps confirm it is if the animal gets better after being treated with the right mite-killing medication, the acaricide.
Response to treatment. Got it. So we've got the general idea. But you mentioned the sources show big differences depending on the host. Let's dig into camelids first. Llamas, alpacas, especially those farmed in temperate areas. This is where it gets really interesting, you said.
It really does. In camelids, the way it presents clinically is quite specific, and this is where a key difference lies. So, yes, it affects the feet and lower legs, like in many animals, but in camelids, you also often see it on the distal limbs, lower legs and feet again, but also the perineum.
The perineum, around the back end.
Exactly, the area around the anus and genitals, and also the ears can be affected.
Ears, too.
But here's the really crucial point. The severity of the disease in camelids doesn't always match up with how many mites are actually there.
Wait, really? How does that work?
It seems to be mostly driven by a host hypersensitivity reaction.
Hypersensitivity. Like an allergy?
Kind of, yes. The animal's own immune system is overreacting to the mites or their products. so you can get severe signs even with just a few mites.
Whoa, okay, that changes things. So it's not just the mite load, it's the animal's reaction that's the big problem.
That seems to be the key factor in camelids, yes.
That must make managing it incredibly difficult then. What are the main challenges?
You're absolutely right. That hypersensitivity is a huge hurdle. Another big challenge is the presence of asymptomatic carriers.
Animals that have it but don't show it.
Exactly. They carry the mites, they can spread them to others, but they look perfectly fine themselves.
Oh, boy.
Then, like we said, the mites can survive in the environment for a while, off the host. So environmental cleaning is critical, but hard work.
Right, bedding and stuff.
Yeah. And maybe the biggest practical problem, there's a lack of licensed acaricides mite treatments specifically approved for use in camelids.
No specific drugs approved for them?
Not many, no.
Yeah.
Plus, camelids have some unique physiological quirks that mean some of the drugs used in other livestock, like porons or injections, just don't work as well in them.
So with all that, the hypersensitivity, the carriers, the treatment issues, this sounds like more than just a nuisance for llama and alpaca farmers.
Oh, absolutely. For camelids, chorioptic mange is considered a really prevalent, economically important disease. It limits production.
Production limiting. That means it affects their growth, wool, maybe reproduction.
All of the above. It hits their well-being, their productivity, and ultimately the farm's bottom line.
Yeah.
It's a serious issue.
So faced with something that complex, that economically damaging, what does effective management look like? You can't just treat the itchy ones.
No, definitely not. The research points strongly towards needing an integrated approach,
Integrated meaning.
meaning several things together. First, targeted diagnostics to be sure it's mange. Then, crucially, you have to treat all the animals in the herd at the same time.
Even the ones that look fine, the asymptomatic ones.
Especially them, yes. Treat everyone. And alongside that, you need rigorous environmental decontamination. Cleaning, disinfecting bedding, equipment, everything.
Breaking that cycle.
Exactly. And for treatments themselves, you've got options. Topical things applied to the skin like lime sulfur dips, permethrin, amitraz, and systemic treatments too, drugs that work throughout the body. Often these are macrocyclic lactones, things like ivermectin.
Right.
But often you need to give repeat doses to really knock out the infestation completely.
Okay, a really intensive herd-wide effort. Now, let's completely switch gears. Cervids. Deer, elk, moose. You said this is a totally different story.
A vastly different scenario, yes. While the same mite, Chorioptes bovis, can infest deer,
Okay.
actual clinical disease, seeing sick animals in wild populations, is actually quite rare. It's much less documented than in camelids.
Huh. So why? Why the huge difference between deer and llamas?
It likely comes down to long-term host-parasite dynamics. Coevolution,
Meaning they've sort of adapted to each other over time?
pretty much. Deer have pretty robust grooming behaviors, which probably helps keep mite numbers down. And over long periods of evolution, they seem to have reached a kind of balance where the mites are present, but usually at levels that don't cause obvious disease subclinical level.
So they just live with them.
Often, yes.
Huh.
Which leads to this really crucial insight for wildlife folks. When you do see clinical signs of mange in wild deer, it's often not the mange itself that's the primary issue. It's usually acting as an indicator
An indicator of what?
of something else going wrong. Usually underlying immunosuppression, maybe severe malnutrition, or some other big health stressor affecting that particular deer, or sometimes the whole local population.
Wow. So in deer, the mite isn't the main villain. It's more like a red flag, signaling a bigger problem.
That's a perfect way to put it. It's a biological barometer telling you something else is weakening the animal's defenses.
That is really surprising. Does this mean we actually don't know that much about how common these mites are in wild deer populations if they're often subclinical?
That's true. Surveillance in wild cervids is pretty limited compared to livestock. So there's definitely uncertainty about the true prevalence, the distribution, and the overall ecological impact these mites might have in the wild.
Right, a knowledge gap there.
Definitely.
And if treatment or prevention is needed for deer, I guess mostly in captive situations, maybe farms or parks, what's done then?
Yeah, mostly in those settings. The approaches are pretty standard, similar to other animals. You might use topical acaricide sprays or dips. Systemic treatments like ivermectin can be used. And good old environmental management, keeping bedding clean and dry, avoiding overcrowding that helps reduce exposure too.
Okay, so pulling it all together, comparing these two groups, it's really clear that Chorioptic mange isn't just one single thing, is it?
Not at all.
Yeah.
It's definitely not monolithic. How it actually looks clinically is deeply shaped by these specific host species, how they're managed husbandry systems, and even their different evolutionary paths.
Yeah, and it's fascinating how the sources mention that old taxonomic confusion too, remember?
Yeah.
How they used to have different names for the mite depending on C. equi on horses, C. ovis on sheep.
Right, based on where they found it.
But then genetic studies showed that actually the mites on cattle, horses, goats, sheep, even llamas were basically identical, so they lumped them all under Chorioptes bovis.
It's anonymized them, yeah.
But as we've just discussed, even if they're genetically the same, they sure act differently depending on the host. Makes you wonder what else is going on there.
It does. And it just underlines that core difference again. For camelids, it's a primary production-limiting disease needing aggressive integrated control.
Right.
Whereas for cervids, it's much more of an opportunistic issue, often acting as that valuable signal, that sentinel for broader health problems.
This whole deep dive really hammers home how complex these host-parasite interactions are.
Absolutely.
And the sources also highlighted areas for future research, didn't they? Like looking into the genetic diversity within the mites, understanding the specific immune responses in different hosts better.
Yeah, and obviously developing more effective, maybe host-specific treatments, especially for groups like camelids where options are limited.
So we kicked this off asking how a tiny mite could tell a big story. And I think we've seen diving into something specific like this foot mite, it really reveals broader truths about animal health, adaptation, immunity.
And how animals fit into their environment,
It's
definitely.
quite profound, actually.
This really raises an important question to think about.
Consider how this seemingly small, localized thing, a mite infestation, can be such a powerful indicator, an indicator of an individual animal's overall health, or maybe even the health of a whole ecosystem. Makes you wonder, doesn't it? What other subtle biological signals might we be missing? Signals that are actually telling a much larger story about the world around us.